Good evening, hello and welcome to Info Corona with me, Rajdeep Sardesai, the show that tries to give you a perspective of all that's happening amidst the noise around Corona. We pick up one specific issue and try and give you a sense of the entire dimensions of it. Now, it's been historically seen that one positive fallout of troubled times is how science and human knowledge grows and expands during periods of crisis. Wars, epidemics have resulted in scientific innovations that were developed to address a specific need. Did you, for example, know that the laws of gravity were discovered in a way by Isaac Newton during the Great Plague in Britain in the 17th century? In these times of Corona too, all around the world and in India too, scientists, innovators and just practical Indians are coming up with cheaper, quicker solutions to how the virus can be detected or neutralized. Today on Info Corona, we take a look at these first innovations that are just about breaking through. Let's tell you what's been happening around the world in the world of innovations around coronavirus.
An Italian company has 3D printed valves for respirator machines when a local hospital fell short while treating coronavirus patients. The valves connect patients to a breathing machine and need to be replaced for each patient. 100 of these valves were printed out in 24 hours. The same company also developed a 3D printed adapter to turn a snorkeling mask into a non-invasive ventilator for coronavirus patients. This innovation is not a legally recognized medical device yet. Companies in different countries are using their 3D printers to make protective face shields for medical staff taking care of COVID-19 patients. A Chinese tech firm has developed a smart helmet that can detect people with a fever up to 5 meters away. It sounds an alarm when anyone with a high temperature comes close. Across the world, many innovators have come up with mobile testing units which will identify the SARS-CoV-2 virus in a patient sample. Some of these kits have given more accurate readings than others, but all of them have given hope that science will find a way out of this crisis.
That's right. We're going to focus on the world of innovations today in the battle against Corona. Now, the topmost concern on everyone's mind is, of course, where is the vaccine that will eventually protect one from the novel coronavirus? Lockdown is perhaps only good enough in the short run. It does not prevent the virus from returning 1 month, 6 months, or even a year later. Right now, the only way to protect oneself is not to catch the virus. But like other viruses that have come before, this too needs to have a vaccine in place before to stop it from spreading. It's no surprise then that there is a global race on for bringing out an effective vaccine against COVID-19.
As an anxious world awaits for a cure for COVID-19, around 35 companies and academic institutions from across the world are racing against time to create such a vaccine. On Monday, the pharmaceutical giant Johnson & Johnson announced its plans to begin human clinical trials of its COVID-19 vaccine by September 2020. They also made the ambitious claim of bringing out the first vaccine batches for emergency use by early next year. This company will be working with the US government to scale up its production. As part of this arrangement, the US government will pay $421 million to support the company's efforts. Another biotech firm, the US-based Moderna, has even started its human trial phase. In an unusual move, Moderna skipped the animal test phase that vaccines go through before it is administered on humans. Other scientists are at the animal research stage and hope to get the results of human trials later this year. The unprecedented speed is largely possible because of early Chinese efforts to sequence the genetic material of SARS-CoV-2, the virus that causes COVID-19. China shared the genetic sequence in early January, allowing the WHO and research groups to work towards a vaccine. Typically, a vaccine takes about 10 years and $1 billion to be developed and then used in the general population. So how far are we from a vaccine? SARS-CoV-2, as a virus is called, shares between 80 to 90% of its genetic material with other forms of coronaviruses that causes SARS. severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. Scientists had already been working on developing effective vaccines to combat SARS, MERS, and are now repurposing them to develop vaccines against COVID-19. SARS-CoV-2 is a novel pathogen in humans, and many of the technologies being used to build vaccines are relatively untested. For the COVID-19 vaccine, researchers are also experimenting with new ways of constructing a vaccine. For the first time, the genetic code of the virus from its RNA is being used to build a vaccine. No vaccine made from genetic material, RNA or DNA, has ever been approved till date. These vaccines are still in the early clinical trial phases and are at least 12 to 18 months away from use. So despite the immense pressure to approve the vaccines quickly, stringent safety testing needs to be conducted to rule out the risk of enhanced diseases before it's rolled out for the public. Because benefit versus risk is the main game plan in vaccine development, and a vaccine's benefit must outweigh the risks. Meanwhile, the World Health Organization has launched a multi-country drive called Solidarity to isolate drugs already approved by regulators for other diseases that can be utilized to fight COVID-19. The reason they are looking at already safety-tested drugs is that these don't need lengthy clinical trials, and many are already on the market. In Melbourne, Australia, healthcare workers have been given a vaccine that's been used to prevent tuberculosis for over 100 years. The BCG vaccine, although specifically targeted against TB, is also known to train the body's immune system to better fight infections. Researchers leading the study now want to see whether BCG reduces the disease in those infected by COVID-19 or exposed to it. But finding a vaccine that works isn't the ultimate solution. Providing it in time to people who need it across the globe will still be the biggest challenge.
I've been emphasizing also upon the importance of keeping your hands germ-free, either through the use of soap or hand sanitizers. But with soaring demand, there's been a shortage in supply of hand sanitizers. Up next, a report from Sangli district of Maharashtra, where a sugar mill is producing hand sanitizers and distributing them for free. Take a look.
With the outbreak of the coronavirus pandemic, there has been a shortage of hand sanitizers, which doctors say are useful to keep our hands virus-free. But with soaring demand, supply of hand sanitizers has been hit. The Indian Sugar Mills Association has written to the centre assuring that the domestic sugar industry would supply adequate quantities of ethanol or extra neutral alcohol according to the requirement for use in the manufacture of hand sanitizers. Ethanol is a type of alcohol and can be made from byproducts of sugar manufacturing. Under such circumstances, this sugar factory in Maharashtra's Sangli district has been turned into a hand sanitizer production unit.
ये बहुत बड़ी डिमांड सांगली डिस्ट्रिक्ट में आई है। शॉर्टेज, बहुत बड़ी मात्रा में शॉर्टेज यहाँ पे सैनिटाइजर्स का, इसलिए हमारे पसंदीदा शुगर फैक्ट्री में जहाँ डिस्टिलरी है और डिस्टिलरी से हम बहुत अलग अलग प्रकार के पदार्थ बनाते हैं, तो हमने खुद सैनिटाइजर की निर्मित की है। आपने पीछे भी देखा ही है। तो ये सैनिटाइजर लगभग 3 लाख 100 ml की बॉटल, जो 100 ml की बॉटल आज बाज़ार में 100 रुपये में मिलती है, कम से कम 3 लाख बोतल हम अपने पूरे डिस्ट्रिक्ट में मुफ्त स्वरूप से पसंदीदा प्रतिष्ठान के मार्फत, हमारे ट्रस्ट के मार्फत हम लोग देना चाहते हैं। वैसे ही यहाँ पे 500 ml की बोतल डिस्पेंसर के साथ जहाँ जहाँ आज आप जैसे पत्रकार हों या मेडिकल वर्कर्स हों, म्यूनसिपल वर्कर्स हों, इनको भी उपलब्ध करके देने के लिए एक अच्छा प्रयास हम लोगों ने किया है।
This comes at a time when the Ministry of Consumer Affairs, Food and Public Distribution has issued a notification directing the state governments to enhance production of hand sanitizers and ensure its availability to consumers.
Now, around the world, there is a shortage of medical equipment and products to fight coronavirus. China, that for some time has been one of the largest manufacturers of masks, PPE kits and other medical equipment, is ramping up production to meet the sudden and increased global demand for such products. But the world and India cannot depend on China, especially in these trying times. So every country is now slowly trying to build their own capacity. In India, non-traditional players are now entering the medical equipment field.
China started ramping up production to fill their domestic consumption at the height of their crisis. And now, with the situation normalizing, they have begun exporting. But not just China. Many countries have asked private players to pitch in and manufacture products that are not their primary expertise to fill the gap that exists. In India, Bharat Electronics Limited is going to manufacture ventilators. Indian auto manufacturers are working to develop and produce ventilators. Some domestic companies have been cleared to make personal protection equipment, PPE kits. DRDO is also collaborating with local manufacturers to produce about 20,000 N99 masks per day. Some domestic manufacturers have already been able to develop low-cost ventilators, but these still need to be tested and verified. During World War II, car maker General Motors made guns and tanks to support the US war effort. Now, GM, along with joint venture partner SAIC Motor, is making machines to manufacture surgical masks at a plant in the southern Chinese city of Liuzhou. This is part of an international campaign that has been compared to wartime efforts. UK's Prime Minister Boris Johnson also privately met up with 60 business leaders to call on companies to help build medical equipment. Around the world, leaders, political and industry, as well as scientists and innovators are burning the midnight oil to come up with solutions. Medicines and machines that will help defeat the minuscule but mighty virus rampaging around the world.
Okay, now the government has also roped in this time ordnance factories to fight this war against coronavirus. Earlier in the day, my colleague Sandeep Unithan of India Today magazine spoke to the chairman Ordnance Factory Board, Hari Mohan, asked him how and what the ordnance factories were planning to do. Listen in to what Hari Mohan had to say.
I have a few questions for you. How did the Ordnance Factory Board get involved in this war on COVID-19?
Yeah, let me share with you, we, the ordnance factories, we are meant to support our country, all our armed forces at the time of unusual conditions of war. And we are fully mentally prepared for doing that. But today, now the conditions are different. The country is at war with the coronavirus. And all our medical fraternity, they are our soldiers now. So now our duty of ordnance factory is to support these soldiers which are fighting in the hospitals, in the dispensaries, our health workers, all our police forces, all this entire government system who is fighting with the corona. We are going to support all of them, and this is the call which I have given to all my 82,000 employees of our organization. And already factories like Ordnance Factory Itarsi, Ordnance Factory Bhandara, Cordite Factory Arvankadu, these factories have already been successful and they have made the sanitizers ready in bulk, and we are ready as much as 50,000 liters of sanitizer liquid. This is equivalent to almost 5 lakh bottles. Today, the first lot we have dispatched from our unit from Arvankadu, which is near Ooty. It has left today forenoon and it is going to the bottling facility of HLL at Trivandrum. We are ready at Ordnance Factory Bhandara. We are ready at Ordnance Factory Itarsi for with our next consignment. Now we are waiting for a green flag from HLL because their bottling facility is getting ready. Once their bottling facility is ready, we will immediately dispatch our next consignment from Ordnance Factory Bhandara and Ordnance Factory Itarsi to Indore. This is about the sanitizer where we have already achieved success. Second thing which we are working upon, the mask, the face mask. Non-medical masks we have already achieved success. These are all new products. They are not our regular products. These products We are establishing only in this situation. Otherwise, we were never prepared. This we have taken as an emergent call of the country, and we are working on that. Our engineers and our chemical engineers are working on that.
Welcome back to Info Corona, where we are focusing on science and tech and innovations in the world in the battle against corona. Now, while the world or large parts of it have come to a standstill with rapid spread of coronavirus, science across the globe is working overtime to come up with newer technology, if not being able to stop the spread at the moment, but at least to try and keep mapping the growth of coronavirus. Here's how the world's scientific community is mapping coronavirus.
Governments worldwide are not relying solely on physical measures. They are taking unusual steps to combat coronavirus. And a tool that's helping them in this war is the smartphone. And this is how it works, tracking the phones of coronavirus patients and suspects specifically via mandatory apps or wristbands. They are told to register on the apps to start their 14-day countdown for quarantine. The applications capture all corners of their designated location and report violations in real time to authorities. Not just apps, a man from Britain is seen in this video explaining how China is now using a combination of technologies to track movement.
The Chinese government collect an immense amount of data about their citizens, and they're using it in novel ways to tackle the coronavirus. Then it's likely that the Chinese government have analysed your face and know where you are.
Countries like China are also monitoring the health status of their people in general. International experts agree that galvanizing multiple tools is the way forward.
Yes, I would say this is probably the first epidemic of or pandemic of the 21st century in which the full power of information technology, social media, artificial intelligence is being applied to almost every aspect of this response. Beyond that, there are a huge number of collaborations around surveillance applications, modeling, predictive modeling, analytics, in decision support tools, and many of these other applications.
Remember, India's experiment with lockdown has delivered mixed results. Experts say the surveillance model other countries adopted is worth replicating in India.
Only testing will not help, only detection will not help. You have to continuously monitor, ensure that those who are detected or suspected to be detected do not break quarantine orders, do not infect others. I mean, take the example of Singapore, where government has launched a voluntarily contact tracing app. Same thing has been implemented in South Korea. Israeli government has taken permission from the Supreme Court.
Privacy concerns have also mounted over the use of these highly invasive measures. But in absence of a medical solution, technology may help enforce lockdowns better, at least for now. With Ankit Kumar, Bureau Report, India Today.
Now, all of us have seen these videos of doctors and healthcare staff wearing suits. They look like space suits, but they are not. These suits that medical professionals wear while handling patients with infectious diseases are called the hazmat suits. But how does it feel to be inside a hazmat suit? How comfortable or difficult is the experience? Ankit Tyagi took matters into his own hands and went looking for answers inside an hazmat suit.
You must have seen all these doctors wearing a protective suit. That suit is called a hazmat suit. But wearing a hazmat suit for long hours and working in trying conditions is not easy. We also have one here. What we decided, just out of respect for the very difficult job that the doctors are doing in very trying circumstances, we decided that we'll try one of these suits and see, give you an experience through me of what is it being inside one of these suits, how difficult it is when you are fighting a deadly opponent like the coronavirus.
Okay, so this is the hazmat suit that I have, and let's now try and get into it. It's not quite an easy task.
It doesn't seem that it's a one-person job. It takes at least two people, in fact, to get into it. Post this entire process, which does take about half an hour, then there is a full disinfection spray, which is in fact put on the medical staff, on the doctors, and that is when they go into the special isolation wards to treat the patient. Usually, the doctors and nurses are doing about a 4-hour shift continuously in this suit. I don't think so. It will. I would be able to do a 4-hour thing, but we'll try. I'll spend some time in this, and then let's see how difficult or easy it was just being in this very suit. So I've spent about half an hour, 40 minutes in this suit. I think it's enough for me, although there's a full process to take this suit off. But I can tell you that it's extremely, it becomes very difficult, and especially when you are trying to write something or you are trying to talk, it becomes very sweaty inside. And in half an hour, I was feeling quite thirsty. We were told that about 4-hour shift, you can't drink water, you can't go to the loo. In fact, in Wuhan, I read a piece where the doctors had to wear diapers because they were continuously working round the clock. There were no loo breaks, no water breaks, and for 4 hours when you are inside this, you can't do anything but, in fact, only go about your job. You can't take it out because you are in a complete sterilized atmosphere. I just did it to, in fact, try and understand how difficult it is to be in this suit. And it has, being in this for only about 1 hour, half hour trying to put it on, and about half hour, 45 minutes being in this, it has, in fact, given me or invoked in me a new sense of respect for the doctors, for the medical professionals, those who are working round the clock, trying to treat patients, take care of them. They are the real heroes.
That's right. It's a bloody difficult job in these days to be a doctor on the front line against corona. So we salute the coronavirus, and that's the reason each of these people in the medical profession need our support and gratitude today. Thank you all for being there in this continuous coverage on coronavirus. It's time for a break. Rahul Kawal, my colleague, will be on the other side with News Track. Stay tuned and stay safe.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.